The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. This hot procedure is kind of sweeping the country. More and more women are going and getting mommy makeovers. With us, we have a board-certified plastic surgeon, Dr. Cohen. Dr. Cohen, welcome to the program.
Nice to meet you, Randy.
All right, now, before we get into today's topic, tell me a little bit about your practice. I mean, who's your typical patient? What do you spend most of your time doing?
Got it. Well, I've been in practice for about 6 years in the Scottsdale, Arizona area, and I get a wide array of patients, but I'd say typically most of the patients are somewhere in the range of 20 years old to mid-40s, and I see a lot of patients for body contouring, breast surgery. That's pretty typical for my practice.
Okay, good. And so the procedures you do. Now, by the way, when did you know you want to be a plastic surgeon?
I actually knew I wanted to be.
You don't look like a plastic surgeon.
Well, I actually knew I wanted to be a plastic surgeon in high school. I saw some TV shows about plastic surgery when it was a lot less visible, I guess, to the public, and it just seemed like something I was very interested in. I ended up working with the local plastic surgeon, just watching him do procedures, and it just was right up my alley. I did a lot of drawing and sculpting, and it just fit in with what I like to do.
How many years have you been in practice?
Been in practice 6 years now.
6 years, and do the patients actually say, "Hey, how old are you, doctor?"
Every once in a while, I get a patient who comes in. They give me the look. I can always tell what the question is, and I'll preempt them. I'll say, "You want to know how old I am?" And they start laughing. And I say, "Well, I'm 38." So it usually relieves them a little bit that I'm not just.
And you look younger than your age. Are you doing some things?
Just
skincare,
not smoking, staying out of the sun, wear sunblock, and try to stay healthy.
Okay, good. And you grew up in Arizona.
That's correct.
And then, and tell me about your background as far as training.
Okay, so basically, after high school in Phoenix Country Day School in Arizona, I went to Emory University in Atlanta for my undergraduate, then to Tulane University in New Orleans for my medical school training, and then after that I went to Dartmouth for both general and plastic surgery training, and then after that I did an additional optional year of aesthetic surgery fellowship training with Grant Stevens in Marina Del Rey, California.
Okay, I've seen him, I've heard of him, I see him in the airline magazines.
He's very well known surgeon.
Yeah, very, very well known. In fact, well, let's move on to mommy makeover.
Sure.
So what defines it, mommy makeover?
Well, people a lot of times will come in, they'll say, I need a mommy makeover, or they say, what is exactly a mommy makeover? And what they don't realize is it's not just one surgery. It basically just defines a grouping of procedures that women will tend to do after they've had kids and have a lot of changes in their body that they can't fix with diet and exercise or some of the things that they do on their own. So when they reach a point where they're still not comfortable with how they look, but they've done everything they can, then they usually will come to see a plastic surgeon to see if they can get them more comfortable about their physical appearance.
Who's the typical patient that's actually coming in for these and do they call it a mommy makeover? I mean, do they walk in and say
it's a pretty well-known term now, and they usually will say, well, I want a mommy makeover, rather than saying I want breast surgery and tummy tuck surgery. Mommy makeover is basically surgery that involves correcting the breast, whether that's an augmentation, a lift with an augmentation or a reduction in certain cases, something with the body, usually a tummy tuck, but it could be a mini tummy tuck or a full tummy tuck, and often liposuction, very often in the love handle areas or in the inner and outer thighs. Basically whatever a woman needs to make her feel the way she did before she had kids.
And where are you doing your surgeries, by the way?
Basically, I have my own surgery center, so it's a state-accredited outpatient surgery center, same standards of safety as the hospital operating rooms, and I always tell patients I only use board-certified MD anesthesiologists, and all the nurses I use are critical care trained, because absolutely safety is the #1 factor for me.
Okay, good. And for the mommy makeover, what's the high end of range? Obviously the ones that are right after pregnancy.
In terms of age?
Or weight loss, I guess.
I've seen some patients who are in their 60s who are interested in mommy makeover type of surgery. People always say, well, am I too old or this or that? And I always say it's not a matter of age, it's really a matter of health. So if somebody comes in and they're 30 years old and they have some major medical problems that are not appropriate for surgery, they may not be able to have surgery. Whereas somebody who's in their 60s, if they're in good shape and they're exercising every day and they're cleared by their primary care physician, they should be able to have the surgery.
So breast, tummy, and a tummy tuck or liposuction. Now, is it safe to get those?
Yeah, well,
in the same day.
That's what people wonder. Actually, when I was with Grant Stevens, we did a number of research papers on that particular topic: is multiple combined surgery safe? And it was actually published in the Aesthetic Surgery Journal, and we did prove that it is no higher risk if it's done properly on the best selected patients, taking safety as a number one priority. But otherwise, you can combine these surgeries for an effective result.
How soon after pregnancy could a woman do it?
There's not an exact time range, but I usually want women to be at their steady state. So if you do it too soon after a pregnancy, their tissues can still be shrinking, or their breast may still be involuting, meaning shrinking down, or there may still be body changes going on. So I usually recommend approximately 6 months or so, preferably a little bit longer, sometimes a little bit sooner if they really feel like they've hit a steady state.
Is this one of your favorite procedures?
I would say yes.
Mommy makeover?
It's one of my favorite procedures.
Why?
Because it's probably the most dramatic surgery that I do, where somebody comes in and a number of hours later they look completely transformed. It can make so many major changes at the same time, and patients are always amazed at how they look at themselves after surgery and they say, wow, sometimes they say, I can't believe I look this good. I didn't even look this good before I had kids. So
is that right?
Yeah, so it really makes me feel good. And really what I like the best are when patients come in and they don't feel confident about either being in the nude with their husbands, or they don't feel comfortable going to the beach, and then all of a sudden after surgery they come in with different types of clothes on, and their attitude
change of personality.
Completely changes their personality in some cases. Not always, but I do find that a lot of people really get a boost in their self-confidence and
Are you ever surprised with the way it affects them?
Not so much anymore. When I first started, some patients I couldn't believe the transformation. I was almost asking myself, is this the same person that I saw, a few months ago for a consultation? But now, I've seen it so many times in a row. I really just believe that this surgery makes people feel better about themselves.
In a tough economy, do you recommend doing procedures like this?
Obviously, people have to prioritize what's important in their lives. So, you need to take care of the basic things first. But a lot of patients feel that their body and feeling good about themselves may be more important than a new fancy car or something else like that, and they have to make the decisions that's best for them.
Okay, who should get a mommy makeover?
Well, technically, it's not a mandatory surgery like having a cancer surgery or something like that, but the people who I think are the best candidates for mommy makeover surgery are the people who are working very hard to try to get themselves in better shape and are doing everything they can to be as healthy and youthful as possible, and still can't achieve the goals that they want because of lax skin or stretched out tissues, or just drooping the breast that you can't fix with diet and exercise.
And what's your advice on what should a patient look for in a surgeon that's going to do the procedure? Mommy makeover.
I think that's probably one of the key, most important things that patients need to know about, because there's plenty of people out there who say, oh, I do cosmetic surgery, and many of them are not properly trained. So number one, you need to make sure that your surgeon is a board-certified plastic surgeon. American Board of Plastic Surgery. There's a lot of different boards that have fancy long names but aren't the same. And then number two, you need to find somebody who is very experienced doing this kind of surgery, who you can see a lot of before and after photos and know what the quality of their work is, and kind of follow a bunch of different patients and see.
So you show before and afters?
Absolutely. I think that's critical. If you have a patient who comes in who hasn't seen any of your work, I don't know how they would trust you to do their surgery. They need to see consistently what kind of results you're getting with these types of surgeries.
Okay, what else should you ask of a surgeon?
You need to ask, how long they've been in practice, how many of these surgeries are they doing a year, and make sure that they're not pushing the wrong surgery on you and that they're listening to what you want, because some patients may not want larger breasts, they may want smaller breasts or just lifted breasts, and if somebody's saying, oh, you just need an implant, it may not be the right surgeon. So they have to listen to you and be aware of what your goals are in addition to what they think is going to be best for you. You also want somebody who's going to also not be afraid to make recommendations if you're not exactly sure what you need to get you the best possible results as well.
Okay, now after pregnancy,
Correct.
or in their 40s, in their 50s, the women, are they more so needing breast reductions, breast lifts?
Totally depends on the patient. So,
Now, what about incisions, by the way, on breast lifting? Isn't that one of the problems?
Yeah, one of the things that people always worry about is the scar or the incisions for surgery. I always tell patients the most important thing is the ultimate shape of the breast. So we need to make sure that the breast shape looks good. In some cases, you can get away with just a small incision to put an implant in, or just a tightening around the areola itself. Other patients need a fuller lift. If they have drooping skin and you put an implant in or do a surgery where you're not properly lifting the breast, they're just going to have a larger droopy breast, which defeats the whole point. In most cases, when I'm doing a lift with implants, I can usually get away with what's called a lollipop scar, where you have a circle that goes around the areola and a line that goes down the breast, but no scar underneath the breast. And a lot of surgeons...
Is that a big concern, by the way? Of women? Is that their number one fear? Like, they want lifted breasts, but they're afraid of these scars?
That's a very common thing. Some patients are very worried about the scars. Other people are really just mostly worried about the shape of the breast. But I always tell patients your anatomy is really going to dictate what type of surgery is going to work best for you.
Okay, you said and I interrupted you. There's another technique that surgeons use.
You know, a lot of surgeons will automatically do what's called an anchor scar, where you have a circle, a line, and then another line under the breast. And that under the breast scar can be problematic for some patients. So it's always best, if you can avoid it, to not put that scar there, especially if it's unnecessary.
Okay. How much art and how much science in doing this?
You know, I'd say there's quite a bit of each. I think if you don't know the science behind the surgery, then you're not going to get the safest results for your patients. You have to understand physiology, you have to understand how the surgery works, wound healing, etc. But on the flip side, you can study as many books as you want. If you don't have that artistic eye for surgery, you're not going to be able to get them that incredible result that they're looking for.
Okay, so with women that come in, okay, so the tummy tuck or lipo, at what point does it become a tummy tuck? And not lipo.
Liposuction is good for patients who have tight skin but excess bulging of fat in an area that won't go away with exercise. A lot of patients who come in from pregnancies don't have that situation because their skin has been stretched out or their abdominal wall has been stretched out. Once you have laxity of the tissues, meaning looseness of the tissues, liposuction can actually make things look worse rather than better, and you need to do some kind of skin tightening. Although in most patients, the back area, love handle area, is usually a good area for liposuction because generally the skin does not stretch out there with pregnancy, and that'll give them better definition of their waistline if you do liposuction in those areas.
Okay, so now what about the face?
Yeah.
You know, we call it a mommy makeover,
Right.
but you know, for the 50-year-old, 60-year-old woman, which is very young today, especially in Arizona.
Right.
What are you addressing the face?
You know, not simultaneously. So there's a limit to how much surgery you can do at one session. For me personally, I don't feel comfortable doing an entire body makeover and doing a facial surgery all at the same time. So with those patients who need both, I'll generally recommend staging things out, where we do basically a torso correction in one phase, let them heal up, and then do facial rejuvenation surgery at a later point.
And in your practice, what are you doing for facial rejuvenation?
You know, it basically, once again, depends on the patient. So I tend to see a lot of patients in their 30s, 40s, 50s, so a lot of them need eyelid surgery, or they need sort of a more modified facelifts, and then, you know, the older patients who have more laxity, and especially in the jaw and neckline area, will need full facelifts.
Okay, good. Mommy makeover. And as a recap, what are the benefits they receive?
I think that's ultimately the point of the surgery is, what do we get out of the surgery? Why are patients doing it? Because it is a big surgery to go through and a big investment of their time and you know, recovery. So what they get out of it is sort of a feeling that they can look the way they want to look and can see results with their exercise and with their diet, and feel like they have a better self-confidence and attitude about how they feel in clothes and also at the beach and you know, in intimate situations with their significant others.
Okay, good. Now are there reasons why people are getting mommy makeovers? I mean, do they tell you, I'm getting married, my daughter's getting married, going to a reunion,
you know,
vacation?
Sometimes patients will say things like that. In general, they'll say sort of what I was alluding to before. Hey, you know, I had pregnancies, I'm sort of done with it, and now I don't look the same way that I used to. I've done everything I can with my trainer, I've been watching what I eat, and these areas still won't get better. And then they'll say, you know, I really want to feel as comfortable and confident as I can be. How can you help me? And I'll say, well, you know, these are the things that I can fix, and as long as you're continuing to maintain your end of the deal, which is staying healthy, diet, and exercise, then we're going to get a really nice result together.
Okay, good. And how long will these results last?
You know, different areas last different lengths of time. So tummy tucks will generally last many, many years because there's not a lot of gravity acting on things. Same with the liposuction. Breasts tend to be a little bit more high maintenance for a lot of patients because there is more for gravity to work on. So over time, they may need touch-up surgery to retighten the skin as the breasts stretch out. And also, if you have implants, the implants are not meant to last forever, so they will have to have them removed or exchanged at some point.
Okay, good. Now I may have asked these questions, but what are the frequently asked questions? Okay, a mommy makeover, they come in, you know it's a consult for a mommy makeover. What do they say? I mean, what do they want to know?
Well, a lot of times they want to know, you know, how long am I going to be out of work or out of commission? When can I start exercising again? Things of that nature. So I always let patients know, don't underestimate the surgery, especially if you're going to have a full tummy tuck. You need to take it very seriously and plan accordingly. So I usually recommend a couple weeks off of work to really recover and get better. And then as far as exercise, I usually try to limit my patients no major exercise for at least a month to 6 weeks after surgery, and I sort of play it by ear depending on how they're healing up. And in terms of you know, just general activities, they're going to be able to do light, normal activities starting you know, within the first week after surgery, but they just have to listen to their body, let it guide them as far as how much they can or can't.
What are their fears, by the way?
You know, the biggest fear I hear from patients is anesthesia. They always wonder, you know, is anesthesia safe? That's probably the most common thing. Surprisingly, I'd think it would be more surgical issues, but and I always let them know, you're going to have a board-certified MD anesthesiologist who's one of the best in the business taking care of you, and anesthesia is extraordinarily safe these days. So if you pick your patients carefully and make sure they don't have any major underlying diseases, the risk of anesthesia is a lot lower than doing like a couple-hour road trip in your car.
So you have your own OR there.
I do.
Operating room there.
Yes.
And then a little recovery area as well?
Yeah, well, full-sized recovery center, exactly.
Full-size recovery. And
then for these kind of cases, I always require patients stay in an overnight facility for at least one night, preferably 2 nights. And we do, my complex, and there's another surgery complex in our area, have a recovery center that's right next door that does overnight nursing care. So I'll usually have my patients stay for 2 nights after a full mommy makeover.
So with these mommy makeovers, do they come in with their partners?
Yeah, sometimes
do you encourage it?
I always encourage it. I think the more family involvement you have, the better the patients are going to be. I definitely, if there's a question of between the husband and wife whether they should do it or not, I always want them to work that out before they actually undergo surgery. But some patients will come in by themselves. Some patients will come in with their husband or significant other or kids. It just depends on the situation.
Now, as a plastic surgeon, do you ever get people to say, and this, I'm just going to throw this in, where they say, "What's wrong with aging gracefully?"
You know what? There's nothing wrong with aging gracefully, and I always tell people, this is a very personal decision. So not everybody is interested in this kind of surgery, and if you're not, there's no reason that you should do it. This is a surgery for the people who are trying to look their best and just can't because of things that are out of their control, such as loose skin, stretched out muscle layers, things of that nature that they can't fix on their own.
Okay, and now your website, you have a lot of before and afters
Correct.
on there.
I have quite a few.
When they come in, now, by the way, as far as breast implants, are you using the like silicone or gel filled?
I use almost exclusively memory gel implants, which is a cohesive silicone gel implant by Mentor, and I find that silicone is going to give patients a much nicer looking, feeling, acting breast. The salines, they're fine, but they don't give you the same level of result.
What about your incisions? Where do you go?
Again, it depends on the patient. So if I'm just putting an implant in, I usually make a very small half circle incision at the edge of the areola, which is extremely fine and well blended. If somebody needs a small lift, I can sometimes get away with just tightening around the areola where you just have a circular scar. But in a lot of patients where they have significant drooping, they're going to need that lollipop scar and very rarely that anchor scar.
So tell me about this. If the nipple area of the breast, because I've talked to, I know plastic surgeons seem to be divided.
Yeah.
Some hide it underneath, in the fold, in the armpit, the belly button.
Right. For
and the
breast
nipple area
augmentation
seems to me like the most dangerous area because the scar can show.
Yeah. See,
so what's your case? Help me understand more.
I disagree with that, and basically a few things people worry about in areolar incision, and I should also state specifically, people always worry about, you're taking the nipple off. Absolutely not. With all these surgeries, the nipple is left connected to the underlying breast tissue. Okay. But as far as the areolar incision, a couple major advantages. Number one, the skin there is very thin, so the scar tends to heal with a very fine scar. Okay.
All right.
Number two, you're already seeing a circle there where the areola is, so the scar blends along that natural circular junction, so it actually hides the eye. And number three is that a lot of patients don't have a perfect shaped breast. They may need a little bit of lowering the fold or adjustment of the crease, and if you go through the areola, you can make those adjustments without worrying about the scar being too high or too low.
So it gives you more control?
I think for me, I get more control over the crease of the breast and the overall shape of the breast. And for me, the control of the breast pocket and of the breast itself is what gives me the quality results that I need. Because a lot of patients have asymmetry, and that can be a big factor when you're dealing with
Okay, tummy tuck. I didn't ask enough questions, I think, and we're almost out of time about the tummy tuck.
Sure.
Do you have a certain technique, a goal in mind?
I don't have one particular.
Doesn't it leave a pretty big scar?
It can. Well, the scar is a long scar, but usually it's a very fine scar, and you can place it low, so it's well hidden beneath any kind of a normal bathing suit that a patient would wear. I don't have one specific technique. I have multiple techniques that I use depending on the patient. In general, for most patients, they're going to need a combination of removal of a lot of excess skin and fat of the lower abdomen, plus internal stitching to tighten up the muscle layer so that the abdomen is flat again. Some patients, they just need a moderate amount of tightening. I've had some patients who look like they're 5 months pregnant after they've healed up from the pregnancies, and they need multiple directions of tightening to flatten their abdomen down again before you do the skin tightening.
Now, with all of these women that are men and women that are getting these lap bands, things like that, or losing 50 or 100 pounds. Yep. That's a category, obviously, of mommy makeover.
Exactly, and the term mommy makeover, as we said, it's not a specific type of surgery. You don't technically need to be a mother or have kids to have this type of surgery. So for somebody who doesn't have kids but has had a lot of weight gain and weight loss, they may also be very good candidates for a combination of breast surgery and tummy tuck surgery as well.
Okay, good. Final message to a woman that's considering the procedure.
Okay, I would say number one, make sure that you're in the best health you can be. So you should be watching your diet, exercising. This is not a quick fix surgery. it's going to have very major dramatic results. So in some sense, it is quick fix, but you also need to do your part to make sure you're as healthy as possible going into surgery, doing everything you can on your end.
Okay.
And then the Mommy Makeover is going to fix the things you can't fix for yourself. And you can exercise for 100 years. If you have loose skin, that skin's not going to shrink up, or the abdominal layer that's been stretched out is not going to shrink up. And that's where my part comes in to help you feel good about yourself again.
Okay, good. I want to thank you for coming on the show. Very interesting.
Pleasure.
Good stuff. They can
Thank
go to
you
your
very
website. And your website is what?
It's robertcohenmd.com.
Okay, I want to thank you for coming on the show.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.